Good morning. Welcome to this is May, right? To the May session of the Disabilities and Conditions of Aging uh, virtual network. And really, this is meant to be a table for all of us to come to whenever we can, but hopefully once a month to simply talk about what's impacting the disability community within our particular little niches of it, where we are working, how we can support each other, how we can support our community better as a networked um, group of folks who are informed. And so that was always the original vision. I'm Jeremy Warner. This is Walking Spirit is my organization, and that is a accessible DEI and belonging consulting and support organization that is there really to advise any organization in the private sector and even the public sector on how to go beyond the Americans with Disabilities Act. While I am an ADA trainer, what I am hoping to bring to folks is a recognition that that was meant to be a starting line, and it's time for us to take a 35-year-old first step and go beyond that within the broader community. And so that's what Walking Spirits focus is on. To that end, as I was saying in our early 5 minute waiting period there, that I was on vacation, well, little vacation. My wife Irena spoke at a conference in Atlanta last week, so I got to work from a Hyatt Regency hotel room and spend my whole week doing that, which of course with my background in the hospitality industry led to me having the director of operations and the chief of engineering up in my room to explain to them that you don't want a guest with a disability to feel like they have to rearrange the room that is intended to be accessible for them upon arrival. And so we walked through those things. And then after that week in Atlanta, my wife and I drove down to Disney and celebrated both our ninth anniversary and our 50th birthday years by going to Disney's Hollywood Studios and Galaxy's Edge, where I got to pretend to be a Jedi for a couple days. So lots and lots of fun. And we can talk about that. But I did want to share with you guys a brief video if you haven't seen it on any of the social media that I've put out there, which is me getting out of the pool because the accessible lift that is required by law to be there was not present. And well, rather, it was present, it wasn't functional. And the issue really was that over 4 nights, I reported multiple times that the battery was not present in the lift, so it wasn't functional to get me in and out of the water, meaning that even though it was present, they still weren't ADA compliant. I was informed that I needed to request the battery so that they could set it up whenever I wanted to use it. And I had to explain to them that that's not the intent behind the ADA or the regulation that they have a lift because they're considered a public pool. And and then I also had an issue when checking in with the shower bench not being in the room. And the first desk clerk that I mentioned it to told me that they had removed those and no longer carried them on property. The second desk clerk that I spoke to actually was able to get it in my room within the next hour. So, but this is the experience of
Recording. So, because the lift is not functional, for me to be able to utilize the pool, I first have to get down out of the wheelchair onto the ground. And to get back, this is what it requires. When the accessible equipment is not functional, it creates liability risks for the hotel. There's nothing safe about that.
So the reason that I wanted to share that with folks is because I keep seeing these issues everywhere I travel, every time I travel. And as Rick and I were talking about, it's not just one particular hotel brand, it's everywhere. And and that really is a result of uninformed folks providing the training and people in terms of the operations teams not caring about the accessible equipment that is meant to be there for us to be able to access everything. So, wanted to share that so that you guys could see it, but also I am finding that if we're going to get anybody to address these issues and take it seriously, trying to make those phone calls. I have spent so much time calling corporate offices, trying to speak with risk management departments, and being told that they can't transfer me to the very people who are supposed to minimize the risk. So I believe that what we need to be doing is showing these these instances as much as we can over social media so that we can grow the awareness through the public that really needs these modifications to be present. So, and accommodations. With that in mind, that's my soapbox for today. I am going to turn it over to the rest of you. And please utilize the chat to put in your contact information as well as any videos or links or information that you need to share with everybody. I will send that out to the group. And thanks for being here. With that, I am going to call on the first person, and I'm just going to go ahead and call on Carly from the ARC.
There, everybody. I know it's been a little while since I've been here. It's good to see all of you. And sorry for that. It has been busy season. So thankfully things are slowing down a little bit. Um, just a couple of things that I wanted to share. Um, at the beginning of the year, the state put out amendment proposals for the health and wellness pathways and TBI waivers. And then they submitted new plans for the family supports and CIH waivers. We did the first round of public comment. They will drop the updated versions. They are supposed to do that next Friday for the second round of public comment. I think one of the big reasons why there was such a huge time span in this one was because they were trying to see if any legislation passed that would have impacted the waiver proposals. So that's what they were waiting on. But those will drop next week. So highly encourage you to share your public comment on that. And then literally about 45 minutes ago, something like that, FSSA has put out a request for feedback. They are looking for feedback on, wow, trying to explain this is going to be hard. So I'm not going to try to keep it concise. Um, One of the things that changed last year with the health and wellness and pathways waivers from the aged and disabled waiver was that legally responsible individuals, spouses or parents of minor children, could no longer get paid for attendant care to care for their loved ones. One of the things the state has been looking at is should they adopt a definition of extraordinary care that would allow those legally responsible individuals to be paid for attendant care. They have just put out something seeking feedback from the general public on that. And like I said, that dropped about 30 to 45 minutes ago. So, and Jeremy, it's in your inbox. So,
I was gonna ask. Yeah,
yep.
thank you. Yeah, that this being my return to work day, I literally turned on the computer 5 minutes
That,
before the meeting began. So
that is totally fine. One other thing. So last night, the U.S. House of Representatives passed the one big beautiful bill, which was the budget reconciliation bill that had a lot of cuts to Medicaid and to food stamps in that. It now needs to go to the Senate where it's expected that there will be a lot of changes to it. But this is when people really need to weigh in on this because one of the things that they did was they cut $300 million from food stamps. They are radically cutting Medicaid. And what exactly was in there is kind of, an unknown because they've been doing this very, very quickly and in the middle of the night. So part of it is finding out exactly what's there. But some of the things, some of the things we are very worried about here is that um, there were cuts to Medicaid expansion, which in Indiana, that is what HIP is considered. And if there are any cuts in the federal funding for Medicaid expansion, HIP will automatically go away. There are too many people who are on HIP. Um, whether they are people with disabilities who just can't get through the Social Security process, or they are individuals whose Social Security is slightly above, the poverty level, or they're the caregivers for individuals. Those are a lot of the people that HIP covers. So a lot of things going on right now. And I feel like I do nothing but like spread bad news everywhere I go, and it's really kind of getting to me because I am just Debbie Downer all the time.
I know how easy it is to get there. I do because I feel that way a lot too. Um, but I also, after traveling around quite a bit, despite all the obstacles, still believe there's plenty of reason for hope. And so, with that in mind, does anybody have any questions for Carly? Any comments that you want to bring up while we are on that topic that is impacting us very much? And I would also ask Carly if you know if there is anybody working to put together that comprehensive list of what cuts have been made, why, in the dark of night.
I'm going to say no because they are so extensive.
Okay.
So I know that like the Arc of the United States has been working on this since January 2nd. Our whole focus has been on Medicaid. There are also, just all sorts of cuts that have been coming through the federal government. Um, you know, my goodness, they eliminated SAMHSA. How do you
Right.
eliminate SAMHSA? You know? Um, and those are just just the cuts within one department. I think the spreadsheet was like 43 pages long. So I
That's
say this, no.
actually, I mean, on most of my presentations now, I include up front because we talk about the trauma of the accident usually. I
Mhm.
include up front that if anybody's going through anything to contact them, and I'm realizing now I have to change all of my presentations.
Yeah.
So, wow. Um, anybody else, any questions, comments for Carly before we put the next person in the hot seat?
Hey Carly, this is Jim from Hamilton County Health
I
Department.
did.
How you doing? Hey, I feel your pain. Our budget was cut by 70%.
Yeah.
So, as a local health department, some stuff that we used to do, there we're not going to be able to do it anymore just because of that. So,
Right.
I feel your pain 100%. And also, like with what's really bothers me is 988. They're getting ready to cut number three, which is the LGBTQ stuff, which we know that's so important for those folks
Oh
that need
yeah.
that support. So I'm with you 100%.
Yeah. Yeah. No, absolutely. Absolutely.
Jim, if you would you mind just going ahead
Sure.
and
Sorry about that. So,
also if you
go ahead.
could go a little bit more, I don't know, in depth into to your comment there, but also I don't know if you would have any contacts with in the LGBTQ community who might be willing to come on maybe next month and chat, talk
Right.
about that.
Okay. Sure. So I'm Jim Ginder. I'm with Hamilton County Health Department. I'm the health education and outreach coordinator here. So I oversee all the outreach and education as well. And as previously mentioned, we receive money from the State Department of Health to do multiple programs. And we just received notice that 70% of our funding was cut from our budget from the state. And that is even more for the smaller health departments as well, too. So some of our smaller colleagues will have huge cuts. I work a lot with our tobacco group, and I just found out from them that, again, this is hearsay from them, that Marion County employs 7 tobacco individuals that does education and prevention. They have to get rid of 4 of those people. So we're kind of in a situation right now with, what are we going to do in the future? Currently, in our health department, everything is okay right now. Um, because we have budgeted for stuff. So we're okay. And you're kind of at the LGBTQ thing. I will see, I know a lot of those folks are really kind of apprehensive about getting involved in stuff just because
Right.
of everything going on in the world. But I will talk to them. I can tell you that I also oversee the STD HIV division here too, and also test as well. And I have a lot of those folks who are very apprehensive, even about coming here to get tested, just because they don't want anything attached to them. And what's great here is we assign them a number. So, and you can tell me, since you mentioned, Jeremy, since you mentioned Florida, I was a keynote speaker in Disney World a few years ago, and I did the exact same thing. So if they want to say their name is Yoda, you know what, that's cool with me as long as we can get them tested as well too. And we're also seeing a huge issue with our transgender folks as well too. A lot of them are very uncomfortable with going to their providers as well too. So that's something that worries me. I had an individual who is in the process of transgendering, and they're scared to death about continuing that process because access to their hormones that they need to be who they really want to be. So I really feel for those individuals in that community, and we're just here to support as well and do as much as we can do for our residents and individuals that need education or support as well too. Sorry, I didn't mean to ramble, but it's just,
No,
yeah.
not at all. I mean, I think it's an important part of our community that frequently does get ignored and left out.
Mhm,
And
mhm,
especially in light of the attacks on Section 504 and what that was really about,
mhm,
um, or at least part of what that was really about, because I don't know that any of us know fully. But especially the focus on removing people who are transgender from the definition
mhm,
of a person with a disability that
mhm,
was in Section 504. Um, that, and I don't know that I'm even phrasing that right, but I think it would, if anybody knows anyone who wants to speak about that and wants to share with other folks within the disability community what that experience is like, and how this is all impacting their part of that community. I would be happy to talk about how we do that in a way where they feel safe, where they could do it anonymously with the camera off and a
mhm,
different name in
mhm,
on the screen, whatever, however they want to do it. But absolutely want this space to be open to that if
mhm.
anybody would like to.
And I really appreciate it. And I think something else we need to discuss real quick. If any of you have individuals that are in the process of trying to break the habit of tobacco use or vaping, that's going to be very difficult because that's one of the huge funding cuts that the state or our government above has said tobacco and vaping programs are being cut right and left. So, and we know tobacco isn't the same kind of strong addiction like cocaine use is as well too, and those folks need a lot of support and a lot of resources. Again, I have a colleague of mine who does tobacco education in January, or excuse me, June 1st, she's done. Her whole organization is done because the grant was cut significantly and there's not enough money to continue. So we're picking up a lot of, because we do education already on vaping and stuff. So we're picking up some of her stuff so those individuals aren't kind of left without a resource. So just something to think about.
Thank you very much. Any questions or comments for Jim? Okay. I am going to call on Rick Edwards.
Sorry, can you pass me by for a minute?
I can, absolutely. Passing Rick, I'm going to call on Kendall Tilton.
All right. Usually I talk about me, but I put the flyer in the thing. So wanted to make everyone aware that Indigo is talking about fare increases. Um, this will for the formerly Open Door, the paratransit users. This will raise their trips from $3.50 one way to $5 one way. Um, there will be upcoming public hearings on this. Just so everyone's aware, that's a substantial increase, and if you compare it to the top 20 uh, cities in the U.S., it makes us the biggest increase in the past 20 years in any of those cities, and the most expensive paratransit system in any of it. We may be second, but by a substantial amount more than most of the other cities. So just if you wanted to attend public meetings, they're on their website. That's going to be a big change. They for city bus riders, if you're using my the oh god, I can't think of the name of the my ticket the on the app. So if you're prepaying, and you can use the card too, but if you're prepaying, they do some things to ameliorate that. So your if you ride 5 days, your fifth ride is free. So some of that is ameliorated for um, riders of the regular buses. It's just paratransit that has no breaks from that. The regular bus routes or the regular bus prices will go up as well, but they do have a mechanism that you can get discounts, but there's nothing for paratransit. So just so you know, I bring that joyous news to everyone.
Thank you. Um, any questions for Kendall? Kendall, anything else about Noble?
As I put my flyer in there, we are still looking for uh, people in the career center that are looking to our career exploration group. We've moved a couple people on to hopefully to careers, and we have some openings. So looking for people. That's a waiver service, um, funded the same way that you would with day program, but we build job skills. We volunteer 5 days a week, um, and build resume skills, and so those sort of things. So for those people looking don't know quite what they want to do, and we're targeting people coming out of high school that maybe didn't get the services in high school that would be ideal for that. They push them towards other things rather than learning about employment. So we do have openings. So if you know anybody that is looking for that, send them my way. I'd love to talk to them.
Okay, thank you. Um, all right. I am been looking at the chat. I haven't seen anybody say that they have to leave early today. If you do, please put a note in there about that so I call on you sooner rather than later. And I'm going to call on Allison Weimer from the Governor's Planning Council.
So I was wondering if I turned on my screen, you were going to call on me.
Actually, I moved my chat box and there you were.
That's totally fine. I don't mind talking. I apologize though. I am fighting off a summer cold, so I look like dew, and I might be coughing a lot. So I apologize.
You're fine.
Um, um, I wanted to first off, I before I talk about what's going on with council stuff, I wanted to kind of add on to what Kendall is talking about, because I am a uh, rideshare user, I don't normally use the public transit system just because of scary people on the bus, but I uh knowing now that it's going to be $5 every time, it actually will be cheaper for people to use the like Lyft has a this thing where if you go to the same place all the time, they have this set uh price, and it's literally like $3 no matter like where you're going. So that's actually cheaper, which is really sad, that it's like less expensive to use a Lyft than it is to use public transportation. Um, so yeah, anyways, I just wanted to put that out there, that it should be like not that expensive to use public transportation. And also for people with disabilities, I think it should be, um, even less so. I just think it's so cost prohibitive for us just to get from one place to another. And, when there is no other option, when we don't have the option of driving a car, and when we don't have the option of somebody driving us, it's really, uh, you know, uh, a barrier, to accessing anything. So, anyways, that is my soapbox for today. Um, so, or one of my soapboxes, I guess, because I'm about to tell you about council business. The number one thing, and I'm sure, I mean, Jeremy, you sent this out. I know that this is, Daisy, shh. Sorry, my basset hound sees, the man across the street, mowing the lawn. And although Apple is very well behaved because she's my service animal, Daisy is not. So I'm sorry if you hear her growling.
Didn't hear her at all.
Okay, good. The I'm sure you guys saw the memo, the leaked memo of the possibility, the talk about movement, the talk about elimination of DD councils. Honestly, there hasn't been any other information after that. It's like that memo got leaked and then there was nothing. So everybody is kind of in a holding pattern. But that doesn't mean to say that we're not still concerned. The federal funding is really what's the biggest worry, is that, there won't be any funding sent to us beyond what we have been sent. And so I think what we are really pushing for right now is for, number one, community, but also letting everybody know for the disability community to go out and tell people how important it is to have a developmental disability council, in every state and territory, and why they're important. And if anybody is wondering what they are and who we are and what we do, because you are like, what do you guys actually do? Are you just sitting there like watching people or whatever? We are doing something called Council and Community. And that is where we are going out into the state, we have a bunch of council and communities coming up. We have a virtual one coming up on uh, June 17th. And there's going to be information put out on our Facebook page and on the website. But of how to register if you're interested in joining us for those. We're going to be doing one up at Turnstone in July, and we're going to be doing one at Fuse in June. So on June 19th, I believe. So if anybody is interested in joining us, please check out our website or check out our Facebook page. Or you can email me individually. I'd be happy to send you the registration link. Or I can send you the flyers, and if you want to get them out to people, I'd be happy to send them out to you. We would love to have, more participants. But anyways, the council community is going to be a way for not only us to share with people what a DD Council is, what the DD Act is, but also we are gathering information from the community about what makes a good life for people in Indiana with developmental disabilities. So we're getting feedback from the developmentally disabled community as well. So that's basically what we've been up to lately and what's going on with us.
Thank you very much. Any questions for Allison? I know you're not feeling well, so I don't want to keep you on the spot for very long.
It's totally fine. I'm happy to answer questions or talk more. I've got coffee.
Very good. Me too. So I was going to ask, would it be possible for you, since you mentioned it a couple times, your Facebook page, would it be possible for you to put a link to your Facebook page in the chat?
Yes, I will have to ask. I don't have the link to that, but I will have to ask Kate, and then hopefully she can get that to me while we're still on.
Okay. Yeah, that would be cool. Just to have those things. I'm finding that the more that we can be connected, I think the better, even throughout the months, just simply by following each other's Facebook pages and whatnot. So
So I
I,
wanted to,
yep.
want to ask a quick, I was unaware of the LIFT program. Do you have anything on that?
Yeah, it's if anybody signs on to Lyft, like onto a Lyft account, it will automatically offer it as a new member or whatever. And
Okay.
there's also a link that you can go on when you sign up, and it's I can't remember exactly what the program is called, but it's like it's it's a program where if you go to the same place every single day, they lock in the price for you. So and it's at a reduced price, and it's really, really, really cheap. So yeah, it's about $3 a day. So.
And do you know if they will accommodate wheelchairs or mobility equipment on
Yes,
that same program? Okay.
yes, they have multiple uh 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 what's it called? Options on there. And they also have unlike Uber, which is I find less, I mean, it's accommodating, but it's not as well defined. They have like an option for a pet one, which I do because I have a service animal, not because I have a pet, but because that way I can guarantee that I'm not going to have any issues with a driver giving me any kind of, oh, I can't have a dog, blah, blah, blah. I'm not going to, and then I don't have somebody like driving away from me or something like that. I don't have to argue with anyone. We just get in the car and go. So, it's not an issue. And it doesn't cost me anything more. It's just that's my option, and then I go. And it's so great to have that option. So I prefer Lyft over Uber for that reason. But yes, they do have I'm not sure if they have I think it depends on the needs of the person in terms of like how big the mobility device would be, but they do have people with vans, and I'm almost positive they have people with that would have wheelchair accessible vans. So, I mean, yeah.
Okay. Kendall, just out of curiosity, knowing about programs like that with what they're changing at Indigo will actually become more affordable. Is that something that the Mac could potentially take to them to say, hey, you guys might want to rethink some of this?
I would think we could talk about it. I don't know how persuasive it would be. Um,
Yeah, I know you can't make any
completely
commitment.
opinion. In my opinion, the less they have to do, the happier they're going to be, is the honest truth. Um, Allison's also, I mean, do you feel the same way, or?
Yeah.
Yeah, no, I think they'd be like, great, go, see ya.
Uh-huh. Okay. Good to know. Concerning,
Yeah.
but good to know.
I think that if somebody else is going to pick up, I mean, this is just being real. I think if somebody's going to pick up the responsibility, if it's a private business or if it's another company or whatever it may be, then that's going to take less uh, pressure off of whatever is going on with that agency at the moment. And the directive from the executive branch right now is do more with less. So that is I think that I don't necessarily think that it's a it's not being negligent because they're trying to get not take care of people or not be um uh not help everybody. I think that there's just only so many resources to go around, and unfortunately it's the most needy people out there that are going to see the the lack of resources because of this. I really feel like that's going to be the kind of the trend out there. That's just my feeling. But
Okay. Anybody else have any comments or questions? All right. Then I am going to call on Heather Wildrick Holman.
Good morning. Hopefully you can all see me okay. Heather Wildrick Holman here with Firefly Children and Family Alliance with Community Partners for Child Safety, Assistant Director of that Marion County-based program. To kind of piggyback off of some of what's already been talked about this morning, news in our arena is we had applied for, I may slightly get the words wrong, but the Health First Indiana grant. And those are supposed to be announced for our safe sleep initiatives. Those were supposed to be announced in January, and we just presumed that we didn't get them because it was radio silence. We weren't finding out. But then we discovered that we did. We got our contract funded at 65%. So on Friday, we went to the meeting for awardees, and we found out a lot of the same information that's already been kind of discussed. So some of that was they had to go back to the drawing board because there was considerable cuts from that initial, uh, you know, grant, or I'm using the wrong words here, folks. And then they also had to go back and rework because several of the awardees were folks working in that tobacco cessation world or arena, and they were told that none of that fund could go to that. So much so that we do have some slides in our Safe Sleep PowerPoint that are going to have to be reviewed, because we also too talk about how that's a risk factor with SUID and SIDS and safe sleep and all those various things. One of the things we are potentially looking at, and we were told we could do, is eliminate some of that language from our presentation, but talk about it verbally. So I thought that was interesting and something that we're kind of looking at. Just how we can still get out important information, um, and just have maybe, having conversations with folks about important things versus like that. I don't know if I don't know. Anyway, more on that we're kind of examining, looking at. We also may be in a loophole because we fall under the maternal child health kind of category, and it may be okay for us to talk about it in and under that umbrella or that space. And then the other piece that is having to be examined is initially they had said that if you were not a U.S. legal or U.S. citizen, we cannot use those funds for any programming, any initiatives funded by this grant for that. So there was a lot of back and forth on that. And so now they've reworded it. I have the slide and the exact language, but it's reworded to say if you are lawfully here in the US, we can use those funds to serve those people. So I just found a lot of interesting takeaways. There was kind of a lot of chatter in the room when they announced the information about how none of those funds can be used for tobacco cessation, with the knowledge, I saw someone in the chat, the increase in the taxing on tobacco use. There was a lot of chatter around that in the room on Friday. This was Marion County specific, in terms of Marion County health department and kind of that coordination of those state dollars. But we are excited to have at least partially funded this Safe Sleep Coordinator role, to expand our safe sleep initiatives, to just get and reach out to more folks in the Marion County area, and that important information. Otherwise, we continue to do our parent education support group. We do that virtually 3 times a year. We'll be rolling that out again on June 4th. We run that 3 times a year. Like I said, it's an 8-week virtual class on various parenting kind of topics, really leaning into the whole notion of gentle parenting, if you will. What else did I want to share? Yeah, we love being in this space. I love being able to take the information I glean from you all in this space and take it back to our program. I guess a real quick thing is I was curious, Jeremy, if Mary Alice, I think her name. I was curious if she's reached out to you from the Mirror. I had a great opportunity to connect with, I think her name is Mary Alice Malloy at the Mirror, and talked a lot about just our initiatives we're doing. We do, in home-based prevention services for Marion County around preventing child abuse and neglect. And she was really interested just about the work we're doing, the connections we have out in the community. And she asked, what are things not being talked about that Mir could highlight and signal boost and make sure that those stories or those topics and that information is being heard and is being given a platform. So I said, oh gosh, I need to get you connected to Jeremy.
I thank
So do what?
thank you. I don't know that I have heard from her. I will have to look back through my emails just to double check.
Yeah.
Um,
And if anyone else knows of anything, I'd love to get her connected to anyone else in this space that thinks like, yeah, this isn't being talked about. And I thought it was really great that she asked that question, and she put me a little bit on the spot, but I said, oh gosh. So I gave her a few names and yours was one. So
okay.
anyway, but I think those are the main updates. I'll put information about our program in the chat. Always glad to be here.
Please
Thank you
do.
all.
Thank you. Any questions, comments for Heather? All right. Then with my last 10 minutes, I get to go to both of the Edwards on the call. Jill Edwards, how are things at the public library?
They're okay. Uh, they're okay. We're all hanging in there. Similar to everybody else, there are funding things coming our way. But we're lucky in Marion County that the way that we're set up, we're a little more, we're not as impacted as smaller places. Um, and that will definitely impact everybody's ability to meet the needs of the people who live in their communities. Anyway, as I was saying that though, as you all have been talking, I just keep flashing to what can I do and offer? Um, and I don't know what that is, and I'm certainly listening always. And if you have specific thoughts, I set up programs throughout the whole library system for adults. And one of my two primary areas are art and health. Um, and a lot of things fit into that, including mental health. And we have some cool things coming this fall that I definitely want I'll tell you about as soon as we get them. I have links to send you and whatnot. But we have some cool things that are opportunities to pause and just breathe and engage and spend a little time. And I want you all to know that those are there. If you don't have, you don't have to have a library card. You don't have to be a resident of Marion County, and nothing that we do costs money. So please do um, check out those options because and I'll put a link in the chat to the online calendar so you can just kind of see what that looks like. But we do things throughout the whole system, and taking an hour for yourself to just go to a concert or attend an art class or whatever it might be. I really want people to do that because more than ever, that's really important and valuable for people to have that self-care time. In specific, we do have, I run a program for caregiver support. Um, and they meet every other week for chair yoga in one room, and simultaneously in another room there's it's kind of like a memory cafe but a social hour,
Cool.
so that you can come and have just some time to breathe and engage with other folks, and also don't necessarily, if you have somebody that you're caring for, you don't have to have them right next to you and feeling like you have to attend to them. But also maybe you're here for the social hour, and that's fine too because people need that. So that's at Beech Grove Branch Library, and that'll be on that online calendar. But once a quarter, we also do a lunch and learn connected to things that we're hearing from the folks who are attending. In March, what I heard from folks is we've got folks coming who are not yet part of the systems and don't understand what is a waiver, what do these things mean, and all of us know that's changing very rapidly and unexpectedly. And so in June, we're going to have a lunch and learn with free lunch, um, where we have folks from Socoa and SHIP and different places to just answer questions so that it's not a formal presentation and nobody has to worry about oh, well, yesterday something came down that changes everything. But they can have just a little bit of intro and connection and familiarity so that if they're in a situation already where that would be valuable to them, they have a little more comfort with that. And if some of our folks are looking at that, like we have a group of 5 sisters, 4 of them come to the program and they have a sister at home who needs care, and they've not actually engaged with any of the systems. And so learning what that looks like and how to engage things is really valuable. So we have that coming up in June, and we want folks to know about that, but also to hear about it. I'll put some stuff in the chat, but also just I'm here to support and take care of folks in the ways that I can. So let me know what those are, and please do feel welcome to come to libraries, including the library is beefing up its accessibility topics. And taking a more concentrated look at how to be more accessible. So if you encounter a situation that is not positive, let me know, let somebody know, because we're working to improve those.
Thank you. Any questions or comments for Jill? All right. We have about 5 minutes left, and Rick, you're going to close us out. Before you come on, I want to just mention Matt Holland had to go before he had a chance to say anything. He is from the Coalition for Homelessness Intervention and Prevention. This was his second time joining us on the call, and they print and distribute a mobile handbook of help that has been referenced in the previous meeting and can be requested. So their information is actually still in the chat from last month, and so just wanted to point that out. And then also before I hand it over to Rick, Jill, you're talking about how the library can help. We're talking a lot about cuts. The fact is, the need is not going to go away, even if they take away the funding and everything. So the more that the library can help us engage and communicate with the community and form a well-informed and involved disability community, that's huge. And one of the things that we are working on right now, we being Walking Spirit on behalf of Everybody Counts, is developing the Disability Empowerment Unconference, Nothing About Us Without Us, which is about training up a diverse group of people with disabilities from across the state about disability, culture, history, rights, advocacy, and community engagement. And that information is in the chat, including their flyer to share. And Rick, would you please fill us in on things from DNR and just from Rick Edwards' perspective, because I find that very important.
I appreciate it. I had 4 things that I wanted to share. First of all, we are still meeting with the Secretary of State to have a discussion about the lawsuit. I think that even though it appears that they're all of the same mindset, that it is not trying to question the constitutionality of 504 ADA, I still want to keep the pressure on there and make sure that that receives the light of day. I did a podcast for Outdoor Sportsmen a few weeks ago. I don't think it's up yet, but I'll give you the link as soon as I get in my office. I wanted to make sure that you had access to that. Our webpage. If you will, make sure that, and I'm going to send a link as well to that, but there's a survey on that webpage that I think is going to be continuing to offer a great deal of information and support for continuing DNR programs. I think it's going to be very important for them to get that kind of feedback, that kind of interest, that kind of recognition that, yes, more than just hikers, bikers, hunters are visiting our properties. So, and the last thing was in regards to the chairs, the track chairs. With all the cuts and everything else that's been going on, I have been putting a lot of pressure, frankly, on our people to make sure that that money does not go in a different direction. So they are in the process of moving forward with that. I'm thinking that we're probably talking about sometime in the fall, we'll start seeing these things. Unfortunately, with the budget and with the process that we have to go through, all the bells and whistles that have to be clicked and ticked off and all that sort of thing, that it takes quite some time. You can't just simply take that money and go buy these things. So you got to go through all sorts of bidding processes and that sort of thing. So, and unfortunately, it's going to take longer than I want, certainly, than most people want, but it's still moving forward. Still, I believe, going to happen. So that's what we're looking at there.
Okay. As always, let me know if I need to go somewhere, record something, and send it to you to use as proof that the track chairs are important. Um, and
Well, if you want to go try out the track chairs, feel free and record that and say, what an amazing thing it is. On our website, you'll see where they have trail chairs that are available. So,
okay, I will take a look at that. And any questions, comments for Rick? All right. We are 1 minute over. I do want to quickly read the comments that Matt had put in the chat, just in relation to our conversations earlier. The VA is considering updating transgender veterans' gender in federal systems and birth records back to assign sex at birth. It truly is unsafe for transgender folks, even more than before the administration's change. And then he also commented, yes, that it would be great to support smoking cessation with the increase in tobacco taxes. So, and then he had to go. So, as always, thank you, everybody. Please do help promote the unconference. And yeah, again, the need's not going to go away. So, the more that we can communicate and support a well informed and involved disability community that honestly is able to grow to where we can communicate on a level where we don't have to rely on organizations to let us know when we need to speak up. So, um, and how and where to do it. So, thank you all very much for being here. I truly appreciate it. Have a wonderful month.